get started. Dan Tenorio sent out the invitations for all of you to be, he sent out the invitations for all of you to know that we're going to be doing this webinar today. This webinar is focusing primarily on working with limited English proficient clients and being able to help them as best as possible, ensuring effective communication. Dan, unfortunately, I guess, is having some technical issues, so I will go ahead and get started. For those of you who are unfamiliar or haven't participated in these webinars before, we do them every fourth Tuesday of the month. The next one is going to be August 26th, and we're going to be focusing on class standards. Class standards is, they're the standards that were created by the Office of Minority Health, the U.S. Department of Health and Human Services, and they developed the class standards to help organizations essentially be able to create a welcoming environment for people from diverse backgrounds. And so we'll do the next webinar will focus on class standards. Today we're going to be again discussing how to achieve the gold standards in interpreting use with confidence, compliance, and care. So let's dive right in. My name is Sabrina Morales. I'm the CEO of Linguistica. We are a government contractor. We're an interpreting agency that's been around 23, almost 24 years. And as a government contractor, we serve government agencies across the U.S. We're currently active in 32 different states. Where we offer on-site, over-the-phone, video remote interpreting, as well as document translation services to government agencies. We do have a few private clients, but our main focus is on government agencies. So today I'm going to be talking about this topic that is really essential, and that is when you're working with an interpreter, you have to know how to work with them effectively so that the interaction goes as smoothly as possible. This is our passion here at Linguistica, and for years I have been working at understanding what are some of the things that we can do to help our clients build that trust with the different communities that they're serving, and also be able to get their message across smoothly, quickly, and efficiently. Just so you know, I actually did start as a medical and social service interpreter in the government sector over 20 years ago. And I was a Spanish and French interpreter many times in legal proceedings and again in medical. So I was in the room supporting families. I interpreted through really tough conversations and seeing real-time disconnects between providers and clients. I noticed that there were a lot of patterns. And now, reviewing years and years of data, we do quality control on our over-the-phone and video interpreting calls, and we're noticing patterns. We're seeing where communication tends to break down and the small adjustments that we can make that make a big difference. So by the end of this session, let's keep it very practical. You should know how to prepare to work with interpreters and how to prepare the interpreter that's going to be working with you, how to support your staff if you have any staff members that are working with interpreters, and how to support them to do, the best, use the best method possible in working with interpreters. You'll also know how to choose the right modality or the right method, whether that be on-site, video, or over the phone. You'll know how to document things properly so that you are audit ready in case Title VI were to audit your organization, or when I say Title VI, I mean Title VI contract monitors or monitors from the U.S. Department of Health and Human Services, even though that's not happening as often anymore based on some changes that have happened with our current administration. We do still have to comply to interpreting standards around Medicaid, JCAHO, and OSHA requirements. So let's get started. So why interpreter preparation matters? First of all, let's talk a little bit about when an interpreter comes in, no matter how skilled they are, no matter how much training they've received, an interpreter will do better if they know what setting they're going to be going into, right? Think about a coworker and you're going into a meeting. If you know what the meeting is about, you're going to know what to expect and you're going to know what the goals and outcomes need to be, right? So if you're giving your coworkers heads up before a meeting, think of that as kind of an introduction to the interpreter. Many times our clients call in and they're using over the phone interpreters and there is no pre-session or preparation. I think that it is essential when we do a pre-session with the interpreter, we prepare them and kind of help them set the tone. So I want to give you a few examples. A phone interpreter was connected to a housing office to help a client complete paperwork. And what the provider didn't mention was that the client was facing eviction and was extremely distressed. So imagine the interpreter, is just answering the phone, very calm, professional. They are trained. They're thinking this is a routine assignment. But what happens in the conversation is the client breaks down and starts becoming very emotional. The interpreter told the supervisor after that session, I wish I had known the emotional state because my tone would have been more sensitive from the start. For interpreters, adjusting our tone really matters because it sets the emotional pace of the session. We can go in as interpreters with a warm and calm demeanor or tone into a very high stress situation, and that will help us de-escalate the situation without changing the words. But if we're too casual or too upbeat in a serious or a sad context, it can almost feel dismissive to the limited English speaker, right? To your client. So knowing the type of session that we're going into is really critical. Now, I understand that sometimes you're not going to know exactly what the session will involve, right? We're going to be interpreting in situations where neither you nor the interpreter really has any idea what's going to happen. But most of the time, I would say you as a provider or staff member, you usually have more information about what the interpreter is walking into. So giving them that 15-second heads up can make a huge difference. During the last webinar that we had last month, we talked about best practices. And we talked about how some clients, they actually send us vocabulary lists and terminology that they use in their state agencies, because that helps us train our interpreters better so that they can use that agency lingo smoothly and know what they're talking about. I gave a lot of examples. I think that's one of the keys, right? When we're setting the interpreter for success by giving them kind of the context of what they're going to be interpreting. And also the more we prepare them with what type of terminology they're going to be interpreting in, that can certainly help. So how do we empower our teams? If you do have team members, but this can apply to you specifically if you don't have additional staff members that you're working with, interpreters do better when everyone is on board. One of the main things that I want to discuss is just a very simple tool, and that is stopping every few sentences, because there's so many examples. The example that I looked up for this particular slide, and that I thought about so many times, this happened to me as an interpreter. This one's about a social worker that used to speak very, very fast and would give huge blocks of information all at once. The interpreter really struggled to keep up. And so every interpreter that would work with this social worker, they would have to ask for clarification or would have to ask the person to stop and let them interpret. After they received a short training, the staff started pausing every 1 to 2 sentences, and it changed the whole dynamic. The interpreter can keep up and the sessions flowed better. I know that sometimes staff members don't do this on purpose, where they just, they have a very short amount of time they want to get through, especially if it's a medical assignment, right? They want to rush through, well, they don't want to rush through necessarily, but they want to get through the assignment as quickly as possible. And in their mind, they're already thinking, I'm having to use an interpreter. This session is going to take longer. I don't have time for this. But know that By asking the interpreter to memorize large chunks of information, they won't be able to do an accurate job interpreting. And they're probably going to stop you and ask you to clarify or ask you to repeat yourself. So in the end, giving them enough time to interpret is really critical. Right now, we've just said, and to summarize all these slides that we've discussed up till now is one, introduce yourself and actually ask the interpreter if they have any questions, or essentially give them a little bit of context if you have any. Hi, interpreter. I'm going to be asking you to help me today with a very critical issue around this patient's follow-up with their diabetes diagnosis, for example, or this is going to be a really critical session around, we had a parent-teacher conference, and this parent wants their student to be evaluated for an IEP program. And we're going to be discussing how we can better help them at the school. Or, interpreter, this is going to be a highly sensitive situation. We have the mom in the room as well. You're going to be interpreting for everyone in the room. Giving a pre-session is critical, and then allowing the interpreter to interpret everything that you're saying. So once you give the little intro, then you can say, okay, let's get started. Do you have any questions? Yes or no, right? A lot of interpreters actually do that on their own. They do what's called a pre-session, especially, and this used to be the case before the pandemic, there were a lot more on-site interpreters. So when we would show up to appointments on-site, we would do what's called an introduction or a pre-session. So I would say something like, hi, Amanda, I'll be your French interpreter today. Know that I will be interpreting everything you say exactly the way you say it. So I'm going to need for you to stop every few sentences so I can make sure that I'm capturing the entire message. Feel free to look directly at the client while I'm interpreting, and I will stop you if I have any questions. Thank you. Do you have any questions? So those pre-sessions used to be quite common when we did on-site interpreting. Now for over the phone and video, those things are becoming less common, and especially because clients just want to get started, right? We want to get started as quickly as possible. The reason why I mentioned so much the reason why I'm trying to emphasize the fact that working with your interpreter as a team can be really helpful is primarily because if you have more complicated situations, you can prepare your interpreter to work with you in a smoother way, right? We will be discussing the class standards. We'll be discussing class standards in our next webinar. So I mentioned at the beginning of our presentation, the class standards recommend that staff members be trained on how to use interpreters. And one of the reasons is because these standards were created for government agencies to provide more culturally and linguistically appropriate care. And they're incredibly helpful. They're super helpful. They're step-by-step guidelines to create a more welcoming and respectful environment for diverse clients. If you want a copy of the class standards, I can certainly email it to you, or you can just Google class standards by the U.S. Department of Health and Human Services. And you'll see Standard 7 talks about training interpreters and training your staff on how to work with interpreters better or more efficiently. So how do we create a collaborative flow? Let's talk about how we can create kind of a natural flow in the session. And this is I think a really good example. I've seen this many times. In a parent-teacher meeting, the school counselor kept talking to the interpreter, not the parent. The interpreter did their job, but afterwards the parent said, I didn't feel like they were talking to me, and that stuck with me. So when we train professional interpreters, we always tell them, you want to make sure that you are positioning yourself, if you're there in person, a little bit behind the provider, meaning a little bit behind the staff member that you're assisting, because you want to encourage the staff member to look directly at their client, right, at the limited English speaker. Speaking to the person directly is going to help you develop that actual flow of the conversation, right? It's not that you want to ignore the interpreter, you want to work with them as a team to ensure that the conversation flows smoothly. And one of the things that you can do is by maintaining eye contact directly with the person that you're speaking to, it essentially just keeps the focus where it belongs. And the relationship between you and the client are kind of solidified, right? You're actually having a conversation with them. So how do you choose between on-site versus phone versus video? We offer all of these modalities because essentially, we want to make it easier for you to be able to serve your limited English proficient clients. But there are benefits to using different modalities depending on the service, right? I mean, if you have a deaf client, then obviously, using on-site or video remote interpreting are your only options. But know that, in previous webinars, we've talked about after the pandemic, on-site interpreting shortages became a huge deal. This is nationwide. It is very difficult to cover on-site appointments and has been becoming harder and harder over the years to cover on-site appointments. So I would say if we focus in or hone in and phone and video, I want to give you just a few tips on understanding when you want to use each of these options. So you want to use phone interpreting when the conversations are like follow-ups or faster meetings, meetings that you're not necessarily, meetings that aren't too difficult, right? You want to use over the phone interpreting more for quick conversations, less complicated conversations. You want to use video interpreting when it's a little bit more complicated, where if you're seeing the person, you're going to benefit from seeing them, whether they understand the message or not. There's a lot of examples around this. I want to give you an example that's more medical, but trust me, I have seen this with legal and government agencies, unemployment services, even legal depositions, of course, because you want to see you as a staff member want to assess whether or not the person's actually understanding the message, right? So this is an example that I like to share that's more medical. So a provider was doing a phone interpretation about diabetes management, and the conversation included terms like A1C, insulin titration, and carb counting. The patient kept saying yes, but wasn't really understanding, which is quite common. The provider later said, I really wish that we would have done this over video because at least I would have been able to see and watched her face and made sure that she understood the conversation. And they could have, pointed to a chart and helped visually support the understanding of the patient in that scenario. So when you're explaining something technical like medical instructions or anything around legal or benefit eligibility, visual support can sometimes help. And I would say more often than not, it does help. So if you're just confirming an appointment, sharing quick updates, like having just a normal, less complicated conversation, I think phone is fine. But if there's new information or if there's a lot of emotions, a lot of difficult or more complicated terminology, if the register is higher, then go with video or on-site when you can. One thing that I want to encourage all of you to do is know your communities. We did talk about this in the last webinar as well, but like, who are you serving? Find out who you're serving. Look at the data that your agency tracks. Look at your census data. Even ask us. We would love to be able to help you with that because we have a lot of data about the communities that we're serving. And knowing your data can help you also hire individuals from those communities, right? We want to be your language support. We don't want to be the replacement for all of your services. And I think that, hiring people from the communities that you serve really does help create a welcoming environment for immigrant and refugee communities. And also, you are essentially physically showing people, we are here to support at every level. Now, you can't hire, 350 different languages, obviously, within your staff. So that's where we come in and help. If you are going to have anyone from your staff interpreting, or you yourself want to provide the service in a different language, if you're providing the service in a different language, it's different, right? You are the provider. But if you are interpreting for someone, you want to make sure that you know what you're doing. So getting trained around how to interpret is essential. All of our interpreters receive a minimum of 40 hours of interpreting training, and we go through code of ethics and national standards. We'd be happy to help with that if you like, or evaluate someone's language ability to interpret, because I can say I interpret in, Italian, but how fluent is my Italian in the setting that I'm going to be in, right? For example, I'm a French medical interpreter, but would I do French medical translation? No, I wouldn't, because I know my limitations. So making sure that you know your staff's limitations on how much they can actually help is really critical. But again, this slide really, I just wanted to emphasize that there are different modalities. And I didn't mention translation here, but if you're giving out documents frequently, you want to make sure that you have them translated, because it is not only not fair, but it's also very difficult for the interpreter to be given a document at the last moment and told to have the client sign a document, or told to have the client take the document. I have been in so many sessions, or I had, I in my past life as an interpreter, I interpreted for so many sessions where the provider would just give me a document and say, have the client sign this. And what I had to do at that point would be a full site translation, which takes a long, long time. A site translation just basically means I'm going to read a document and I'm going to read it in a different language. And, sometimes as interpreters, we're not prepared with the legal terminology that some of those discharge instructions or HIPAA forms or privacy notices, they include a lot of legal jargon, and we might not be ready for that. So if you have a document that you frequently hand out, make sure that you're translating it, especially into those more common languages that you work with. So, with regards to selecting the modality or how you're going to use, a lot of people they don't get confused necessarily. They just get overwhelmed with thinking, well, I'm so used to using over the phone. How do I even go about using video? But remember this, like, we have all been using, and I think the pandemic was a huge, change. Uh, it enabled a lot of us to learn how to use video meetings. But we have a lot of clients that can just as they've tried to do the simplest thing, and I think that that's the way we need to approach this. Let's not complicate ourselves. Many of us have a phone with a camera, and that phone with a camera can be your video remote interpreting device, as long as you're connecting through a confidential platform. So we can either connect you through our own platform, or we can use Zoom, or we can use Microsoft Teams. We can use any of the platforms that have already been deemed by the federal government agencies that we work with to meet the confidentiality standards around interpreting. And by connecting through those platforms, you can have an immediate or an instant video interpreter, right? So if you want us to work with you in more complicated scenarios and work through video, we can certainly do so. Our account management team, Dan, which I'm sorry, he had those technical issues and couldn't speak to all of you today. Dan, Jordan, myself, Raymond, we have an account management team that I think is truly passionate about helping our clients serve people of different backgrounds. And if you need help and need to connect with either a deaf client, or someone that you want a video interpreter instead of an on-site interpreter, we can certainly help you and brainstorm around how to set those tools up. Last webinar, we talked about, if you are going to be using video frequently, setting up a special area so that your teams aren't scrambling at the last minute and going, oh my goodness, how is this going to even be possible? Video is definitely helpful for certain scenarios, and we want to make the best of the technology that we have now. So I want to talk about interpreter visibility and role. Interpreters, when we train our interpreters, we train them on being accurate, being concise, being clear, and never being the center of the attention. So there's a lot of training that goes around, just how do we provide the service accurately, but not take up the session. If an interpreter goes in without training, they can actually become the center of the attention. And all of a sudden, you are speaking to the interpreter, and the client is speaking to the interpreter, and the interpreter has this much more powerful role. That is not the role of the interpreter. So when you are speaking to your clients, speak to them. Don't speak to the interpreter. Don't say interpreter, or can you ask her how she's feeling? Can you ask him if he sent in the form? Can you ask him if he did this or she did this? You want to speak directly to them and say, did you do this? Did you, how are you feeling today? And the interpreter will do exactly the same thing. And in that way of working as a team with the interpreter, usually what will happen is that the client will immediately understand, oh, I guess I'm speaking directly. Well, and if not immediately, they will understand that they're speaking directly to you. Video interpreting is really critical for positioning as well. You want to make sure that you have good lighting, right? Yeah, even if you're working with an iPhone, you still want to make sure that the face and the body language, especially upper body, right, is visible because you're essentially trying to have an on-site interpreter through a video. So if you are using video interpreting, but you have your camera off, or if you're using video interpreting and you're positioning the camera to look at the wall, then you're losing the benefit in using the video. So make sure that you are angling the camera correctly, that you know that you're allowing enough time for the interpreter to interpret, that you have the volume raised, that the little technical things that matter are being taken care of. So when it comes to enhancing clarity, let's talk a little bit about setup. So we talked about how, if you are positioning yourself in a triangle, or if you're positioning the interpreter a little bit behind the provider or the staff member, you can see and hear each other, and there's just a simple shift where the provider says, I felt like I was, really talking to a client. I've heard this so many times. When the interpreter positions themselves in the right place and when that first person interpretation is happening, people really do feel like there's a shift and that they're actually speaking to the limited English speaker. How do we protect integrity in interpreting? Interpreters have really strict codes of ethics, and that means that they really can't change what you're saying, even if they think it would soften the blow, right? I've heard on both sides, limited English clients, limited English speaking clients and non-English speaking clients just they have a way of saying things. I remember a cardiology appointment where the patient was getting a stress test, and the provider asked the patient, "How long can you walk before you get tired?" And the patient responded, I walk 2 streets and I get hot." And as the interpreter, it's like you're kind of like between a rock and a hard place, because like the most important thing for you to do as the interpreter is interpret exactly what's being said, because the clarification happens between the individuals. So if someone says something that is not necessarily responding to the question that you're asking, please don't be upset at the interpreter. The interpreter is being accurate in terms of asking the question, but people say whatever, right? People say long stories. They answer with things that sometimes don't even make sense. And so it's important that you understand that as interpreters, we're trying to be accurate and interpret everything exactly as it's being said. So instead, you have to move forward with asking, well, how long, okay, so you get hot after walking 2 streets. Does that mean that you get tired, or are you feeling that sensation in your chest, or where are you feeling the heat? whatever the situation may be, right? And this is a very specific medical example, but I've seen it really in so many different scenarios, and I know that our quality control people see it all the time. So I have to interpret exactly what you say. And sometimes, that might cause frustration. The other thing that may cause frustration, and I've had this many times too, where the provider or the staff member says to me, just tell them that they're fine, or just, okay, this is what happened. Just go ahead and say it. I'm going to be doing this other thing. And, it's really critical that all of you understand and that, that the role of the interpreter is to interpret. I have been asked to carry urine samples as an on-site interpreter, push people in a wheelchair, carry babies while a patient gets a physical. I've been asked to sign on behalf of the patient or the limited English speaker. There's things that as interpreters we cannot do. And one of those big things that we cannot do is summarize your message or change your message. Now, some of the examples that I gave you are obviously more for on-site interpreters, but know that even for over the phone and video, a lot of things like that can happen. Once I remember I was doing a quality control on a call, and we had a client send in a form and just said, fill this out with the client. Fill this out with the client. I'm going to be on the line. So they wanted us to read the form and fill it out. And no, that's really not the role of the interpreter. So please don't be frustrated with us. I think knowing what our role is going to help you work with us in a more efficient way. So cultural humility and communication. Respecting differences is really critical. I know that sometimes people will catch us off guard because we all think that the way that we experience life is, well, I'm exaggerating here. I'm kind of generalizing, right? But oftentimes we feel that the way that we see life is the way everyone sees life. And I wanted to give you this example because I saw it many, many times. I'm interpreting for somebody and the client is looking down or is not answering the questions or is answering the questions just kind of yes, no, or maybe just saying, mm-hmm. And I see the staff member using me as the interpreter start getting very frustrated. But a lot of the times, understanding cultural issues is really critical. We only hire interpreters that are native speakers of the language that they interpret. And the reason why is because cultural brokering is actually something that interpreters have to do quite frequently. It's not a daily thing, but it does happen frequently. So when the clients, for example, are not engaging, it could be they're looking down and barely responding because that's their culture. They're avoiding eye contact as a sign of respect. So it happens a lot with Native American, interpreters where they explain to us in sessions, oh, I had this, the provider or the staff member didn't understand that, this was happening. So they actually complained that I wasn't doing a good job interpreting. There's some cultural issues that happen that we need to be aware of. And I think it comes kind of a surprise because it catches us off guard because we're thinking that people are going to react the same way that we do. And understanding and taking a moment to look what actually happened. In the interpreting industry, there's a lot of trainings that we give around how to work around cultural brokering. And I'm just remembering right now a story from it was a medical setting again, and this was a patient that was being seen by a very tall provider, and she was, let's just say she was a 4'9", Japanese patient. And she had decided that she was going to cut the pill. So the provider prescribed her this particular medication. And she decided that she was going to cut the pill in half and only take half of the medicine because he was prescribing her, in her mind, that medication for someone that was a lot bigger than she was. There was another story of a Burmese patient that didn't want to take, they were a Tibetan patient they didn't want to take the medication that was prescribed because the pill was red, and the color red to this patient meant evil, and so they didn't want to take the red pill. There's so many stories. It's really, really fascinating. I find it, I'm absolutely passionate about this, about diversity and culture and language. And there's so many fascinating stories about how we perceive the world, and how cultural humility is actually kind of a requirement around working with people of different communities, because things will come up even if we think, oh, this is these are just stories. Things do come up. So what do we do when things come up like that? We can actually ask the interpreter, are there issues that are happening right now? And are there reasons why the client's acting this particular way? Is it a cultural thing? Or, can you ask? Or, so you can actually stop the session and work with the interpreter. Now, sometimes the interpreter will know, sometimes they won't know, but, getting down to the bottom of the issue and really making sure that the person is understanding is what we're there for, right? Interpreters are there to speak the language that the client doesn't speak. And so helping the session flow means that you can stop the session and ask what's going on and how can you help me. Title VI compliance must. I know that there was some confusion at the beginning of the year. March 1st, President Trump passed an executive order designating English as the official language of the US. We did a webinar about this just a few days after that happened. There was a lot of confusion, especially with government clients, because they were saying, are we still required to provide interpreting services, right? Executive Order 14224 basically revoked the former executive order that was signed into law by President Clinton that actually supported the use of interpreting services in government agencies. So I don't want to go through a full description of that because we already did a webinar on that, but I'd be happy to send you more information if you'd like. But what I wanted to say in this particular slide is no matter what happened with this particular executive order, it does not eliminate the use of interpreting services. Title VI is still in place. OSHA, JCAHO, Medicaid and Medicare requirements, state laws that mandate the use of interpreting services. So how do you keep yourself compliant? The main thing is just documenting the fact that you use an interpreter. So oftentimes, some of the things that we do is we'll send you data sets if you want, or you yourself can keep in the, in the front desk area or wherever. Anytime you use an interpreter, document it. Document that what language was it? What time did you request? What happened? Did you actually have an interpreter? Did you use somebody from your own staff? Those are things that are going to help you stay compliant. There's a lot more to say about this in the class standards training that we do next month in the webinar. I can get a little bit more into this, or you yourself can just review it with your, internal compliance offices. But this is something that is critical and oftentimes overlooked, even within large government agencies. So any help that you need around this, we would be happy to help you. Audit ready practices. Again, it's creating documentation, documenting, and tracking patterns to improve access to meet your standards. So let's say, for example, a client called in that spoke Zulu or Kinyarwanda, or a language of lesser diffusion, meaning a language that is not commonly used, and you are not able to provide an interpreter service for that particular appointment. You want to make sure that you're tracking that as well, because you want to make sure that you're covered in all ways, right? Maybe what you want to do is you want to pre-schedule that appointment, which is a great thing to do. Pre-scheduling for languages of lesser diffusion is a great way not only to cover yourself for, legal purposes that you actually provided the service, but also, just to provide better customer service. Like, we don't have this interpreter right now. Can we pre-schedule this? And there are ways that we can certainly help you do that. regularly assessing the interpreter accuracy, like especially if you're using in-person interpreters that are from your own staff. And let's say that you say, okay, well, I looked into how many people were serving. Apparently, there's a large Vietnamese community in my area. I went ahead and, we actually hired two Vietnamese staff members, which is great. And then we're using Linguistica for all other interpreting services. Now we want to make sure that the people that we're using as interpreters are trained. So we're going to go ahead and do that. So there's quality to everything. We can improve every area of providing services to limited English speakers. In those class standards, there's a lot of guidance around that. But again, we can certainly help you do that. A lot of times, client satisfaction is not assessed with non-English speakers. Like you guys might have, and I've seen this so many times, large DHS offices, they have quality metrics for, how they're doing providing services to their clients, but they're completely missing the quality aspect of providing services to limited non-English or limited English proficient people. And these are quality satisfaction tools that you can actually implement. They're not impossible. And using Linguistica as your partner, we can actually help you do this. We have helped people do this before, where at the end of the sessions, you can just say, I'd like to ask you, how would you rate this session today? Or, you are actually, when you're using the interpreter, you're requesting feedback on the service that was just provided. If that doesn't feel comfortable for you, we can certainly translate, or, if you think, well, it's going to be biased because the interpreter is still on the line, we can translate a little quality survey for you and you can send it out in whatever language you need. We worked with the state of Washington, for example, for years doing quality satisfaction census and trying to figure out, where they could improve. We work with the New York Metro Transit Authority, New York Department of Education, Miami-Dade County, with a lot of different state agencies, trying to figure out, okay, how are the services with this particular community and how can we improve them? So interpreter services for us are not just about checking the box. They're about equitable care, tracking outcome across language groups, and identifying disparities and improving services, right? I have seen best practices across the US that I have been so impressed with. I know that for those of you who are in this call, you are also passionate about, how can I do my job better? We spend so much time at work and if you're passionate about working with, about providing better services to people that have limited English proficiency, we are here. We would love to be able to support you in any way. But there's a lot of things that we can all do to improve. We are in a constant improvement process in Linguistica, always trying to figure out how can we work better with our clients, with the interpreters, how can we meet the shortage demands. And yeah, equity is kind of like a non linear process sometimes, and it's a kind of like a lifelong process for an organization. Now that we have so many AI tools, there's so many things that we can do to improve our services as well. We will talk about some of those AI processes and tools that we've created in webinars in the future, but just know that we've implemented an AI tool right now that can really help with kind of like last minute limited English tools that we can develop and integrate within your systems. So language is definitely more than just a legal mandate. With those right strategies, we can improve services. This is my contact information. I would love to send you, the class standards, or again, you can just Google it and find it. It's a PDF document online. Healthy People 2030 is a great tool as well. It talks about cultural and linguistic appropriate services, how we can better meet the needs of our diverse communities. Those executive orders, all of these things, they're literally just a Google search away, but any tools that you want that, if you just want to expedite those searches, we can certainly send them to you. Email me and I will be happy to send them to you. This webinar will also be available, so if you want to share with other people in your team. And if you want to have us come or present at one of your staff meetings, we would be happy to do so. Because Dan is having trouble with his mic, I'm just going to read out the questions that I'm seeing here on the chat. And one of those questions from House J1 says, would video be appropriate for CPS, and how can CPS access video? Definitely. Child Protective Services is one of the agencies that uses us the most for video, as well as for home visits. And so, yes, we can access that. Your case managers can actually use iPads or tablets. They can use, not to be specific with the Apple products, right? Like they can use any product that's a tablet or a phone with a video, and we can help you set that up. There's a lot of platforms that we work with that meet all the confidentiality requirements. So don't be concerned about that. They will meet those requirements, and we can certainly, so you would basically, this is how it would work. You would just call us, you would tell us what language you need. We would pre-schedule that assignment. And as soon as your case manager is on site at that location, they would just log into a video meeting and the interpreter would be there. So that's kind of the quick summary of how it would work. But feel free to call me or send me an email, and I can set you up with one of our account managers that can just like literally go through step by step on how to do that. Lori said, what is the best way for us to contact Linguistica if we're interested in data information about our community? This is my contact information. You can, we have state by state data. We have, I don't know what state you're from, Lori, but like we have done a lot of research around Medicaid and I guess federal funding and state funding available for government agencies as well. So any information in any data sets that we can send you, I'd be happy to do so. So you can just email me and I'll go ahead and either connect you with one of our account managers, or if I have the data, give it myself. Let's see, Rebecca you mentioned ASL a few times. Is that offered as a service, or is it limited by location? No, ASL is available to any of our clients. All of our services are available 24/7, 365. But know this is kind of the caveat with on-site and with the ASL interpreting. ASL, there's a massive shortage of ASLs nationwide. So what we need to do to cover those appointments is to schedule them with a little bit of advance notice to make sure that they get covered, because those ASL interpreters are far and few, and it's a shame, but they're so, like, one of those, what happens sometimes when, there's just the demand is so high and there's so few interpreters. Not only are they always booked, but what we're seeing now, and this is sad, what we're seeing now is there's less students going into ASL programs. And so a lot of our ASL interpreters, they are senior ASL interpreters, they're also struggling with like carpal tunnel, and they can't interpret as many sessions as they used to before. So we're running into issues. This is not just Linguistica, this is a nationwide problem. So if you're going to schedule ASL, please do so in advance so we can cover and make sure that that appointment gets covered. House J1 also asked, I would love to set that up. My email, okay, thank you. And yes, I will send that to, we love the state of Michigan. We've been working with you guys for so long. Thank you. Makes sense. Okay. Yes. So I think I got all the questions answered. I love this topic. As you can see, I could talk for hours about it. I won't keep you any longer. I'm so grateful for all of you that participated. And I'm so sorry that Dan couldn't, share with you what we have in store with our next trainings, but I think I just pretty much summarized it for him. The next training will be August 26th. And it's going to be on class standards. We will summarize class standards. Any topic that you want to cover around interpreting and language access, let us know. Thank you so much and have a wonderful day. Thank you. Thank you, everyone.